Welcome to DD Healthcare Channel. I am Dr. MANOHARAN, Gastroenterologist, Chennai, India. Today in this video, we are going to talk about a common problem, that is passing blood in stools, otherwise motion. See, we can have bleeding in the stools due to various reasons. The commonest problems are, we know, hemorrhoids, otherwise called piles, and fissure. But when the bleeding occurs, it can occur in different forms. We have to understand some basic facts about it. What are they? The blood can be very frank blood. You sit there, pass stools, there is a frank blood that goes into the commode, with or without pain. This is obvious, anybody can identify this. There are other situations, the blood is mixed with stools and the color will be maroon. You can, by oversight, you can miss it. You may not be able to realize that you are passing stools along with you are passing blood along with the stools. The third thing is, you pass hard stools with little difficulty and you see a streak of blood, a line of blood over the feces, and that also can occur. So the type of bleeding can be variable. In some other patients, the bleeding may not be visible. We call it as occult blood. The quantity of the blood will be very less to change the color of the stools or obviously seen by the naked eye. We have to test the stools motion to find out whether there is blood hidden within it. It all depends from where it bleeds. From the site and the quantity determines whether it is a frank blood or discoloration of the stools or streaking of the blood or totally hidden. Sometimes the stools will be jet black like a tar. See the melted tar, slimy. If the bleeding is going to be from upper GI tract, from the stomach or the upper intestines, by the time it reaches the intestine, that is colon, it is digested upon and the color is totally different. It becomes jet black in color. But you have to differentiate between a hard stool, which is also sometimes black, but the black color due to the blood from the upper gastrointestinal tract will be very classical. That is, it will be slimy, it will not be hard, and it will be shiny like a melted tar. So these are all the ways in which the blood can manifest in the stools. So we'll have to be very careful in identifying whether this could be a major problem or a temporary phenomenon. When we see blood either in any one of these forms, we'll have to find out what could be the cause, natural. The commonest causes will be simple, local causes, that is anorectal region, there may be a fissure, or there could be hemorrhoids, otherwise called piles. A chronic constipator, a patient who passes very hard stools, can also injure the mucosa and produce bleeding. Even in children, even in infants, the commonest cause will be a fissure. Fissure is the most common cause of bleed in all the age groups. What's the fissure? Fissure is nothing but a small tear that occurs at the anal verge, at the outlet of anus. That fissure remains there without healing for a few weeks because there is an underlying sphincter called internal sphincter doesn't allow the crack to heal immediately. As long as the fissure is active, that is not healing, whenever the patient passes motion, there will be a burning sensation, pain, and sticking of blood over the stools. The pain and irritation may last even after passing stools for a few minutes to few hours, incapacitating the patient for a few hours. Whenever they pass hard stools, the symptoms will be more and the pain will be more. This is one thing. So, painful bleeding with burning at stools and after stools, you have to suspect fissure. If there is no pain and the bleeding is going to be profuse, trickling of blood, frank blood, no pain, in those situations, probably you may have to suspect piles. If you are a constipator, straining too much on the commode, you can still produce blood. So these are all the common problems. But at the same time, the doctor has to see other things, whenever a patient comes to them with bleeding in the stools. One is a common disease called bleeding diathesis. The patient may have intrinsic bleeding tendency due to some other blood disorders. They will have to eliminate them. And there are other group of people who take blood thinners for some cardiac or occlusive vascular diseases. They also have the tendency to bleed more even for a small trauma, small injury. So we allow to set aside those patients and then go for a local examination to find out whether it is a fissure or hemorrhoids or injury due to chronic constipation. After ruling out this, if there are nothing, then we are in trouble. That means we'll have to look into the rectum and the entire colon from where the blood comes. Having said the common causes of blood in the stools. Now we have to discuss about the most important, uncommon but serious problems. So whenever there is blood in the stools, you have to be very careful, particularly when you are old. And if it is associated with loss of weight, loss of appetite, general malaise, weakness, you have to be very careful. Why I am saying this is, the commonest serious problem is cancer. Cancer in the colon, rectum, anal canal. All these three places can produce bleeding. Maybe the initial symptom will be only bleeding, painless, innocuous bleeding, small spotting. We call it as red alert. Patients who are elderly with family history of colonic cancer, aged about 60, 65 and above, you have to be very careful. You have to immediately come to the doctor and go for investigations. And other causes will be polyps. The polyp can be occurring in the younger age group, middle age group, older age group. This can also present as bleeding. What is important about polyp is, the polyp today may be benign, just present with bleed, but it can turn malignant as age advances. So it is sometimes a potentially pre-malignant condition. So you have to be very careful about it. Other causes will be inflammatory bowel diseases, that is called Crohn's disease and ulcerative colitis. Fortunately, the inflammatory bowel diseases are not that common in India, but now after the globalization, we also do see a lot of ulcerative colitis patients, regional ileitis or Crohn's disease patient. They also manifest as blood and mucus. In those patients, the blood will be admixed with mucus. It will not be even mixed with stools, motion. So in those patients, we'll have to be very careful and then investigate. There are patients who had cancer for some reason, probably a patient with cancer cervix, a female patient, cancer cervix, operated or not operated, given radiotherapy. For some reason, for some cancer, if the patient received radiation therapy, the intestines get injured and they go in for a condition called radiation enteritis. These patients will also manifest in the form of bleeding in the feces motion. And there are some other rare diseases called angiodysplasia, meaning there is some kind of vascular abnormalities that is happening in the colon wall. Time and again, they just open out, bleed and then stop. The problem with this condition is difficult to diagnose, because only when it is bleeding, if you go in through an endoscopy or do an angiogram, you can diagnose it. When it is not bleeding, it will remain closed. So it will be very difficult to diagnose by the gastroenterologist. There is one more rare problem. Particularly it occurs in younger individuals. SRUS, solitary rectal ulcer syndrome. This is nothing but a small lesion in the anterior wall of the rectum, just few centimeters from the anal verge. It occurs mainly in the young male individuals who are constipating, sitting for a long time, straining too much. They are pushing their hard stools onto the rectum and injuring themselves, and it produces a kind of ulcer, and this causes recurrent bleeding. It also again bleeds for some time, stops on its own, giving a lot of trouble for the gastroenterologist to diagnose. Until otherwise you do a colonoscopy or a proper rectal examination, proctoscopy, particularly when it is actively bleeding, actively producing symptoms, it's difficult to diagnose because we will not suspect it. And when you diagnose it, you'll have to treat it. And the treatment part also little difficult for this particular problem. As long as they are constipating, this problem will persist. Another very common problem is diverticulosis. Diverticulosis is a condition which occurs commonly in elderly people, more than 60, 70, those who live after 70, 80 will invariably have, most of them will have this diverticulosis. What is diverticulosis? Imagine two balloons, one inside the other. There is a small opening in the external balloon. Because of the pressure inside, the internal balloon bulges out like a small bubble. That is called diverticulosis. That's what happens. The inner layer of the colon bulges out through the muscular layers and produces like a bubble. What happens when it occurs? It causes slowing of the bowel movement and then localization of feces within it, erosions, injury, bleeding. So this is a disease because of the age. People who live longer pays this price of developing because of constant contraction, incoordination of the movement due to age. This diverticulosis occurs. This can also manifest as either diverticulitis, inflammation of the diverticulum, and then bleeding. So bleeding can occur in elderly people not only because of cancer, it can also occur due to diverticulosis. Having discussed the common and uncommon causes of the blood in stools, now I have to tell you, when do you go to the doctor? If the bleeding is going to be continuous, profuse and massive, making you to feel weak, anemic, you have no time to go, you have to immediately go. But if the bleeding is going to be chronic, very little quantity, for example, fissure, piles, diverticulitis, polyps, you can probably take little time. But if you are elderly, there is family history of colonic cancer, and if you have loss of weight and loss of appetite, definitely you have to go at the earliest. What the doctors will do, they will conduct a local examination first. They will see your anus, rectum by local examination and proctoscopy, and if they rule out any local causes like fissure, piles, then they will consider doing a colonoscopy. Colonoscopy is not a very difficult test to be undertaken. It needs little proper preparation. So the previous evening they will give you some bowel washers. You have to take it and the entire bowel will be empty by the time in the morning, and they will do it under sedation, and the entire 5 feet long large intestine will be examined by the colonoscope, and they will pick up the lesions and take biopsies if required, and then based upon the findings seen in the colonoscopy, your treatment will be planned. So it is mandatory on your part not to ignore the blood, whether it is small, whether it is frank bleed or it is occult blood. You have to see the doctor at the earliest. Dear viewers, in this video we have seen a common topic, that is blood in the motion. If you have any doubts or any clarifications required, please post those in the comment box. In future, we are going to discuss a lot of such common gastrointestinal diseases. Kindly stay connected with our channel. Thank you.